household, which was also a challenge before, because once the children are enrolled in the OVC program, they could stay there forever. But now we look at seeing that they are graduating, the household's needs are met. So this process looks at all the way from identification, assessment, where we achieve the case plan goals. Next slide, as I end. And the results shows how much we have the children, after doing the analysis, they are low, and those managed to graduate 20% within. We want to say in conclusion that case management is the way to go in terms of best practice, because households are able to come up with objectives and goals that they're able to meet together as they discuss with community health promoters, and this gives them some sense of resilience, because they are able to identify their strengths and resources and work on them. And this and capacity building of community health workers on matters to their resources and their strength, partnership, collaboration, multi-sectoral approach, and integration for successful, sustainable OVC HIV integrated services in line with Ministry of Health, NGAO, and also the community for their participation. Thank you so much.
Thank you so much, Esther, for
by profession, and I'm here to present my best practice, that is effects of malnutrition in viral suppression among Girl HIV 0 to 24 years, a case study done in Kericho Referral Hospital, Kericho County. So you are welcome. Talking of malnutrition, I tend to define malnutrition. It is the uptake, or it's a condition that is caused by excessive intake of nutrients and inadequate intake of nutrients. And as I'm talking about the Girl HIV, I'm talking of the undernutrition that has affected our counties. So next, please. So this is my background. Effective nutrition intervention in HIV is critical in transforming the vicious cycle of HIV and malnutrition to achieve good nutrition status and strong immune response, as well as increase compliance with treatment leading to viral suppression among Girl HIV. Here I'm talking of young children, 0 to 5, 5 to 15, 16 to 17, 18 to 24. This group is a very sensitive group, and in the first phases, when HIV enters into the body, what normally happens, the body immune system tries to respond. And as it responds to whatever has happened into the body, there is production of canines, which are the chemicals that tries to fight the disease. And in that process, so many changes happen in the body. There is nausea, there is vomiting, and all these other things. So the relationship between malnutrition and suppressed viral load is caused by decreased food consumption, which is caused by the first phase that the body is trying to fight the disease. And there'll be ingestion and malnutrition, which is in results change in metabolism and nutrition assimilation. Nutrition, change in metabolism and nutrition assimilation, it means the body doesn't work like before when the child was okay. Because of all these changes, the body immune system is trying to fight the foreign body that has entered into the body. And that is the time that the metabolism, the breakdown of nutrients, the general function in the digestive system is trying to fight, and now the body cannot work properly. Kenya commitment to improving nutrition established in Vision 2030 is designed to safeguard this vulnerable group, decreasing many threats in nutrition disorders. Kenya's static weight is in 26%, underweight is 11%, wasting is 4%. That is in Kericho County. There is 19.3 are moderate stunted, 3.7 are severe stunted, underweight, moderate are 9.2, and 0.7 are severely underweight. Wasting are severely, and then underweight wasting is 1.6%, and 20, out of 226 Cal HIV that we have in Kericho Referral Hospital. Next. My objective when I was doing this was to assess the impact of enhanced nutrition intervention and multidisciplinary approaches in addressing malnutrition in unsuppressed viral load among Cal HIV in Kericho Referral Hospital. Now, why I was very keen in this early intervention, it's because timely interventions of good nutrition helps the body to decrease or lower the progression of the disease. And this is why I did this study, because I wanted to see if what was in my mind was working to help the children to get viral suppression. A case study finding was carried out at KCRH to all Cal HIV with undernutrition, starting July 2023 to March 2024. Random sampling was done. Out of 143 Cal HIV, 10 with severe acute malnutrition with a set score of -3 and below and standard growth, and out of 5 were non-respondent to therapeutic feeds despite previous interventions. Before I started this study, we had some children who were not responding before, but after our intervention, they responded well, and we'll see the results. Next. Analysis of the data revealed from the intervention put in place with malnutrition rate of 23%, which is 143 out of 623, a total Cal HIV. In July 2023 and March 2024, quarterly report shows a drop from 143 to 132, which was 2%. Quarterly report, and others, which was a significant number that has improved the viral load suppression greatly. Others are ongoing with interventions and yet to do the viral loads. This corresponds to a decrease of 36% of HIV-related deaths among children under 5 years since 2023. Next. My conclusion: multi-pronged enhanced nutrition assessment, interventions, psychosocial counseling, and home visits significantly help to improve nutrition status and uptake of drugs and viral suppression among HIV. Food insecurity and misuse of therapeutic feeds should be addressed. Facilities are encouraged to use this multidisciplinary approach, which has shown to yield positive outcomes. Thank you.
Thank you so much, Eno, for your presentation. Yes, you can call in the next.
Okay, let's welcome now Tabitha Togomo, presenting to us achieving viral load suppression among Cal HIV in Mogotio Sub-County Hospital, all the way from Baringo County. Karibu Tabitha.
Good afternoon, everyone. Okay, I'm Tabitha Togomo, a nurse in Mogotio Sub-County Hospital. My presentation today is achieving viral load suppression amongst the Kale HIV in Mogote Sub-County Hospital in Baringo County. Next. Okay. In achieving viral load suppression amongst the Kale HIV, it is a vital for managing the HIV to improve the health outcomes and also in prevention of the transmission of HIV. Next is Kale HIV pose a unique group that needs a responsive program in the community and a facility level to achieve the expected treatment outcomes. In Mogote Sub-County, we have a TX score of 146 as at March 2024, where we had 11 Kale HIV. And among the Kale HIV, we had 6 AYP and 5 pediatrics. So for us, in achieving the viral load suppression amongst the Kale HIV, as we know, it is very critical when it comes to when the child has been disclosed at the age of between 9 to 12 years. Now they have known why they are taking their drugs. Next, please. So now the child, when they have already been disclosed, is now when we have challenges on the viral load disclosure. So that's why we came up with these key strategies of the methodology and how we can manage this Kale HIV so that they could suppress. And also one of them, we came up with Rtwg safe space. These safe spaces is whereby we make sure that they have an off-site support group where they take their medication during the weekends when they are only the Kale HIV. And the pediatrics, we could separate them on their own support groups, while the Rtwg safe space, we separate also, so that they can get their own education as required. So since we could not struggle on the pediatrics because they are under their parents and they really don't understand why they are taking the medication, it was easier for them to suppress. But for the AYP, it was difficult because some of them, they have now known why they are taking their drugs. Others become mute, others become depressed. So that's why we created a peer-to-peer a group so that they can take them through the process and share their journey so that they can help them to overcome the stigma. And also the AYP clinic days, we could integrate also with the support group, and also during a different holiday, we could even arrange for team building during an open day, where they can just come and just play without even talking to them. They just come and have team building where they can eat and just play. And another holiday, we can just arrange for only for education, and another one for the peer-to-peer interactions. Also, timely disclosure was also another key, where if you don't delay the process of disclosure, which is, we know that it is a process, starting earlier from between 9 to 12 years is really the key, because if you delay to up to 15 years, you will get a lot of challenges from these children so that they can be able to cope on the disclosure process and also to overcome the stigma. Another one is individualized case management. This is whereby when these children are not yet suppressed, you ensure that you do the EAC and assign a case manager to go through these children so that they can be able to overcome the stigma. And also the challenges that were addressed, or the lessons learned, was that the late disclosure often leads to stigma and accidental disclosure, thus interrupting the treatment. And also for our case, we had 3 children whom their caregivers are HIV negative. So it was a key role for us to start the caregiver support group so that they can be able to be educated on the adherence issues, so that they can understand how to handle these children and how to go through them even during the adherence session, and also to give them support, psychosocial support, and adherence and nutritional support. Next, please. I've already talked about this. It's also during the caregiver support group, they are also taught how to stop their drugs. Okay, next. This is just a summary of what I've already said. Okay, on the results, during we really, this is just a sample that we used from March 2023 compared to 6 months from March 2023 to September 2023 to 2024. So among our 11 CAL HIV, we had a viral load uptake of 91%, and we achieved a viral suppression of 90%, whereby only one was unsuppressed. On September, we managed to take all the viral load uptake. 72% was unsuppressed because at this time, we had already disclosed to others where they started becoming mute, they could not take their drugs, but after the peer-to-peer support group and also the OTZ safe space, we were able to manage only one client who was not suppressed, but the first suppression the first unsuppression was around 100,000 copies, and the second was around 3,000 suppressed. Next, for recommendation, we really recommend that we address the social structural barriers to treatment access of optimal treatment outcome, and also adapting the caregiver and peer treatment literacy on ART will couple timely procedural disclosure to improve the viral load and ownership to the self-care. And really, OTZ safe space are crucial in peer-to-peer support structures and systematic support system, which system are needed for treatment efficiency. This should also attract the financial support and meaningful AYP involvement to run them, because you cannot run the OTZ on open day, and this comes without financial support. So this was an open day, an annual open day at Mariga Sub-County. In our facility, we started with only 3 facilities where we have in Mogote Sub-County, which runs the CCC. So we could put all of them together in an open day support. And also we had an annual, which is from Baringo Sub-County, all Baringo facilities, where we could have a camp with OTZ Day. Okay, thank you.
Thank you so much, Tabitha, for your presentation. Let's try to keep time as much as possible so that we'll have a few minutes for Q&A, because we'll have the other bigger session here in about 25 minutes or so. So next we'll have Viola, Chief Career. You mentioned your county as you start. She's presenting to us on assessment of nutritional status among adolescents with HIV on antiretroviral treatment in Ololunga Sub-County Hospital, Narok South, Narok County. Karibu.
Thank you. Viola Chikori from Narok County. I'm presenting on assessment of nutritional status among adolescents with HIV on antiretroviral treatment, that is in Ololunga Sub-County Hospital, Narok South County, in Narok County. The background: the HIV remains a major global public health concern that we all know, and on this, that is 10 to 19 years, and it represents a growing population of people that live with HIV. Adolescents account for 16% of the global population, and in 2020, about 1.75 million adolescents worldwide were living with HIV, representing approximately 5% of all people with HIV, 11% of new HIV infections, and 5% of all AIDS-related deaths. And in Kenya, is one of the 4 HIV high burden countries in Africa. AIDS is the leading cause of death and morbidity among adolescents and young people in Kenya. Approximately 51% of new HIV infections in Kenya are among the adolescent group. The purpose of this study was to determine the level of undernutrition and identify the factors that are associated with undernutrition among the HIV positive adolescents that attend the CCC in Ololunga Sub-County Hospital. And my objectives were to establish the prevalence of underweight among the study participants, and secondly, to establish the prevalence of stunting among the adolescents. The main problem, adolescents live with HIV and are known to be vulnerable to undernutrition, bearing in mind of elevated nutrition needs that are imposed by the rapid puberty growth and HIV infection. Nutrition is a major threat to the health of these HIV infected individuals and associated with increased risk of morbidity and mortality as well. There's also a relationship between the nutrition and HIV that is in a vicious cycle, being that HIV compromises nutritional status and poor nutrition further with the immune system, thus increasing the susceptibility to opportunistic infections. On methodology, we use the retrospective record review method, whereby the data systematically identified and obtained from the register, that is MOH 407B, from the month of April 2023 to May 2024. And the study is adolescents 10 to 19 years that were captured in that register. The study area of nation. The assumption of this was that these source documents contain valid and accurate data that was going to help us. However, some of the limitations were incomplete documentation and some missing records. On the findings, distribution by gender, we had 45.7% male and female 54.3%. Distribution by age, majority being 13 years at 11, a sample of 46 in total. The mean age was 13 years. Mean BMI age was less than negative 1.39, and mean height for age less than negative 1.3. The prevalence here of underweight was 34.8, whereby we had severe underweight at 2.2%, moderate underweight at 6.5%. And on prevalence of stunting, it was 30.4, severe 8.7%, moderate 22%. So here, gender is a determinant factor of being underweight with an odds ratio of 2.34 at 95% confidence interval. And on the other hand, gender not being a determinant factor for stunting with an odds ratio of 1.29 at 95% confidence interval. Some of the lessons learned, it's important to note that good nutrition is very important for long-term health and well-being. Linking HIV positive adolescents who are malnourished to a community health promoter for better follow-up can also help in managing the adolescents. Implementing evidence-based interventions to reduce transmission and improve treatment outcomes. Increasing access to and uptake of nutrition services by adolescents is also very key. And also complete documentation of the registers, and also mental health support session, adherence and support counseling for the adolescents is also key. In my conclusion, malnutrition is present among the adolescents, and it's normally exacerbated by their increased nutrition needs. And the review established that there is need for more research on nutrition in adolescents that live with HIV due to their high prevalence of underweight among the HIV-infected adolescents. In addition, the findings also have implications of improving the healthy living of adolescents infected with HIV in Narok County through the acting on a demonstrated prevalence that was noted, and also integrating comprehensive systems of nutritional assessments, as well as interventions within the HIV services to be delivered during routine follow-up of adolescents in the art clinic. Thank you very much.
Thank you so much, Viola. We tried in terms of time. Next, we'll have Annette Sargon. She's talking to us, presenting on improving treatment outcomes for CAL HIV through multidisciplinary team approach, a case of Baringo County Referral Hospital, Karibu.
Thank you very much. I'm Annette Sargon from Baringo County Referral Hospital, and my presentation title is Improving Treatment Outcome for Children and Adolescents Living with HIV through Multidisciplinary Team Approach, a case study of Baringo County Referral Hospital. Background. Children and adolescents living with HIV encounter unique challenges in accessing treatment in human immuno, that is HIV, and achieving optimal treatment outcomes. Without consistent and stable support from caregivers, they are less likely to take their medications correctly and consistently. In households with irregular caregiver to support child medication, these recipients of HIV care are likely to interrupt treatment. They consequently end up with unsuppressed viral load, high morbidity, and mortality. Objective: to improve treatment outcomes, achieve and maintain viral load suppression among the children and adolescents living with HIV in Baringo County Referral. Methods: to improve access to HIV care and treatment for 16 clients who experienced treatment interruption and treatment failure due to change of caregivers and schooling, a case summary were presented to the multidisciplinary team for discussion. So we discussed these cases and we assigned a case manager to these clients. After assigning now case managers, we decided to call the client and the case manager to the facility, and we prepared them prior that we won't be meeting them like the previous day that they normally meet us in our different rooms. So we prepared them that we are going to meet as an MDT, discuss about their cases, and after now discussing about their barriers and challenges, we support them come up with the possible solutions and allow them to choose what will work for them. After now discussing with the client and the caregiver, we introduce their case manager to them, and the case manager will be following up on their cases, supporting them, and in case of any emerging problem, the case manager will be there to address that and support the client. Another thing that we realized about the clients, we realized that the clients that we had lost their parents, 11 of them, they were being taken care of by their families, relatives, and we had to cancel them again on loss and grief. And another thing that we did was to assign 2 cases to each case manager so that they will be educating and educating the new case managers. And this really worked for us because after that, we felt that the adolescents were very free. They could come and greet everyone in our various rooms, unlike the previous, when they were not that free. Results. The supportive environment created for treatment made possible by multidisciplinary team approach has played a crucial role in promoting adherence among the children. The baseline suppression for the 16 clients discussed in the MDT as of December 2022 was 98%. The suppression rose to 93 as of March 2024. This is an indication of a successful treatment outcomes and reduced risk of transmission. This is what I have been discussing before, that we had 16 clients And baseline, only 6 clans is suppressed, which was 38%. And after the multidisciplinary team approach, 15 clans is suppressed. That is the elder suppression of, the suppression was LDL, and the suppressed consecutively 3 times. And we feel that at least that was an achievement as a multidisciplinary team. Next. Conclusion. Successful management of current HIV goes beyond clinical care. Identifying social structural barriers and responding to these barriers leads to better health and social outcomes. Collaboration with other actors to ensure optimal treatment outcomes for children and adolescents is necessary at the point of enrollment in HIV treatment and during follow-up period. Thank you.
Thank you very much, Annette, for that wonderful presentation. May I now take the privilege to welcome Nora Mukire. Karibu Nora. Nora will be presenting to us nutritional supplement or treatment outcomes among malnourished children, adolescents living with HIV, AIDS in Transmara, Narok County. Again, Karibu.
Good afternoon, colleagues. As you've heard, my name is Nora Mukire from Transmara East, and I'm presenting on nutritional supplementation on treatment outcomes among malnourished children and adolescents living with HIV and AIDS in Transmara East sub-county in Narok County. That is the sub-theme. Let's go to the next. The background is that nutrition plays a key role in treatment outcomes among children living with HIV, according to NASCOP 2020. Studies have shown that undernutrition is a major cause of mortality and morbidity among children living with HIV and AIDS. Despite the fact that the food and eating habits is essential in achieving nutrition requirements, some children presenting in clinics have to go through nutrition supplementation since food alone is not enough to meet their daily nutritional requirements. This is because there is an increased rate of 10% in the daily requirements of their energy dense food. Next. The main objective was to assess nutrition supplementation in treatment outcomes among children and adolescents living with HIV and AIDS across the 7 selected facilities that are supported by the HGF in Transmara sub-county. The method used is that we picked all the 7 supported sites, and then we had a longitudinal design where the target population were children living with HIV and AIDS, aged 0 to 15 years, who are malnourished and who are on nutrition supplementation alone in those facilities. And then we also had a stratified sampling technique, which was applied in that 84, all the children that came to the facility, those were 84 during the period of study. That was in October 2022 to September 2023. The result is this. 84 children visited their facilities, and then nutrition assessment was done. Normal nutrition status was 40% out of that. Moderately malnourished were 33.3%. 21.4% had severe acute malnutrition without complications, and 4.8% had severe acute malnutrition with complication. Among the 84, males were 36 and females were 48. Now what we did with this severe acute malnutrition is that those with some without complication were given Clampinas, Rtwg, and they were monitored on a weekly basis. And we used, by that time, we did not have the CHPs. We used the peer educators to recall them back and remind them that they're supposed to come back for refill after a week. And then those with moderate malnutrition were given the FBF. By that time, the food by fortified blended flour was not available in most of the facilities. We had to borrow even from outside our sub-counties so that we give to these children. And after a follow-up of these SAM and MAM cases within that year, there was a significant improvement in their work, their weight between that time. For those that were severely malnourished with complications, in Transmara East, we don't have an inpatient management center. We refer them outside the sub-county. Conclusion. There's a significant relationship between nutrition supplementation and treatment outcomes among children living with HIV and AIDS in Transmara East sub-county. Nutritional supplementation is critical in stabilization of children 0 to 15 years living with HIV and AIDS who have malnutrition. Nutrition requirements cannot be met by just taking the food alone. Therefore, supplementation is required to boost their nutritional status. My recommendation, continuous health education on the importance of good nutrition to caregivers. And then the government should also continually support nutrition interventions for SAM and MAP cases by ensuring the supplements are supplied direct to the health facilities, it be as dispensary or a health center. Hygienic interventions such as hand washing with soap and water to prevent diarrheal diseases, which may affect the nutrition status of these children. I think I'm done. Thank you.
Okay, thank you very much. We've been informed that the governor is within a distant around, so mood is now shifting to the closer. But before that, let us welcome our last but not least presentation from none other than Stephanie Cherono. Stephanie will be presenting to us on leveraging collaborative leadership approach in integrating HIV services in Sigor County, a sub-county hospital, Bomet County. Karibu, Stephanie.
So hi everyone, Stephanie Cherono, and today I'll be presenting on leveraging collaborative leadership approach in integration of HIV services, Sigor Sub-County Hospital. So you'll all agree with me that effective leadership is essential in delivering integrated HIV services and to achieve sustainable development goal number 3, which targets essential health indicators for a healthy population. So siloed leadership approaches have hindered integration of HIV services. This was reflected at Sigor Sub-County Hospital, and there we had challenges in service delivery that led to the adoption of a collaborative leadership approach that was grounded in McGregor-Burns transformational leadership theory. So collaborative leadership values staff contribution towards improvement of performance. So not only the leaders give their input, but we also encourage the staff and they also give their input and they feel like part of the decision-making process. Next. So the objective of this study was to assess the impact of collaborative leadership approach in integration of HIV services. I adopted a descriptive design focusing on the sub-county health management team that are based at the facility and a few departmental heads as the target population. So primary data collection was done through targeted interviews using an interview guide, and secondary data was from reports, registers, and the EMR. So the data collected was comparing 2 quarters from the financial year 2023 and financial year 2024. So quarter 1 and quarter 2. So the data was collected in the month of April 2024. So in the quantitative analysis, we'll see a few indicators that we looked at in integration of HIV services. So the first was HIV testing eligibility screening. This we were comparing the two. So in the average for quarter 1 and quarter 2 in 2023 and average of quarter 1 and quarter 2 in 2024, there was a significant positive increase of 20%. And in addition, we had the number of defaulters that was traced by community health promoters. This was something that we were not doing before. And since the change of guard, we brought in the CHPs, and we can see in 2024 we had 46 defaulters that were traced by the community health promoters. The other indicator was the number of PLHIV with comorbidities being managed. So in 2023, we only had 3, and as a result of thorough screening at the CCC, we currently have 9 clients with comorbidities that are being managed at the facility. The number of clients done cervical cancer screening, we see there is an increase by 37 clients comparing 2023 and 2024, the 2 quarters. Initially, we only did screening at the MCH, but right now we're also doing the screening at the CCC, which ensures that we have no missed opportunity for the clients in need of screening. And finally, number of missed opportunities for HIV testing at the antenatal clinic. Let us note this is ANC1, so we had missed opportunities in Q1 in 2023 of 32, but currently we have no missed opportunities, which means we are really looking into our mothers to ensure that they get tested at the first ANC. So finally, the qualitative analysis, which was as a result of the interviews conducted. So 10 out of the 12 interviewed agreed that there was a positive improvement between 2024 in terms of clarity of growth, inclusivity, transparency in communication, accountability, application of feedback mechanism, and availability of a monitoring and evaluation process. A number of significant respondents, that was 9 out of the 12, also agreed that the application of collaborative leadership in integration of HIV services had led to improvement in services provided and a satisfaction to both the hospital team and the clients. So as I conclude, the introduction of collaborative leadership in integration of HIV services at Sigor Sub-County Hospital led to improvement in service provision. So I'll also recommend for facilities that feel that their leadership needs to adopt this collaborative leadership, I will urge you to adopt the same, because we've seen impact. Thank you.
Thank you so much. We will now have a slight twist of a program because of time and also the events that are upcoming. I hope your questions are ready. We'll give them a chance to respond to that. But just before that, we thought it would be wise to award them the certificates for presentation so that we can continue with the answering question session until the hall is full for the next event, if that's in order. So I would like to take this opportunity to invite my director, the County Director of Health from Kericho County, to come and award the certificates to our presenters in this session. Karibu Daktari, stretch kidogo. Her name is Dr. Betty Langat. Hiyo ingine atawaambia.
Karibu daktari.
Kama iko.
Let's grab for daktari as she climbed the stage to issue certificates.
I'm being harassed by Dr. Bramwell. Atapata barua kwa meza.
So first,
the boss.
Thank you. So first will be Georgina Kingon.
Thank you very much, Georgina.
Camera, this one.
Everywhere. Everywhere.
Okay.
Everywhere.
Next is Esther Kimari for participation on abstract title OVC Case Management Enhancing Targeted Services for HIV Exposed, Infected and Affected OVC. Next is Miriam Valentine on the effect of malnutrition in viral suppression among HIV 0 to 20. Next in line, Tabitha Togomo, achieving viral load suppression among HIV in Mogotio Sub-County Hospital. Next is biology Korean on assessment of nutritional status among adolescents with HIV on ARV in Ololunga Sub-County Hospital. Of HIV services. Thank you very much and well done, Director. Now step on the stage so that we can actually all have a photo with the Director. Yes. Director is saying ladies only.
Promote, you can take the other end so that men are not left behind. Thank you very much, all the presenters. Thank you very much, Dr. Betty.